Not a day goes by without me now seeing at least one or two patients who are presenting with this fairly new yet pretty well understood condition, telogen effluvium. Singapore is going through yet another spike of cases in COVID-19 infections, this time largely due to the XBB Omicron variant. We've seen a 40 to 60% jump in the number of cases over a week. In this episode, we are going to explore a familiar topic, telogen effluvium. But in this case, we are going to focus on a very specific type of telogen effluvium, COVID-19 infection-related telogen effluvium. So let's do a quick recap on the condition called telogen effluvium. In previous episodes, we've explored this in the form of discussing how it comes about. It typically follows a stressor event that can be both psychological or physical stress, and is usually delayed in onset by 2 to 3 months. How it presents is usually as acute or sudden onset of heavy shedding of hairs. And this shedding is not just related to the typical patterned areas of hair loss like a female pattern hair loss or male pattern hair loss, but actually involves the whole scalp. And most patients will complain about it by telling me that they see more hair shedding in the shower, or when they brush through their hair they see strands of hair falling out or even clumps of hair falling out that they've not seen before. So some typical stresses that can give rise to telogen effluvium include starting new medications, having a bad breakup, moving houses or moving countries, going through major surgery, crash diets, weight loss, giving birth, and viral infections such as dengue or COVID-19. So, what does the literature tell us about COVID-19 infection-related telogen effluvium? We've known since 2020 that patients who suffered from COVID-19 infection have been complaining that their hair has been shedding more than usual. But the first paper that was actually published on that came from Italy in 2021, where they showed that hospitalized patients with COVID-19 actually exhibited significant amounts of telogen effluvium. They attributed it to largely the stress of contracting the condition, as well as the severity of disease of them being in hospital or even in intensive care unit. In 2022, a more definitive study that established the role of COVID-19 and its association with telogen effluvium or heavy shedding was published. It showed that sufferers of COVID-19 were 4 times more likely to suffer from telogen effluvium than counterparts that did not contract the virus. And how do we go about diagnosing whether somebody has a COVID-19 related telogen effluvium event or hair shedding event? Well, typically it relies very much on the patient's time course history. What that means is we ask them a bunch of questions, established when they had the COVID-19 infection or other infections, and ask them when the hair shedding was first noticed in their case. Now, if that 2 events actually lagged by 2 to 3 months, we can be quite sure that COVID-19 was actually the triggering event for telogen effluvium. But that's not all. We also do clinical examination. We do a pull test where we tug on different areas of the scalp. We see what hair comes loose and we quantify them. Usually a number of more than 6 hairs that shed easily indicates that there is some degree of telogen effluvium happening. We sometimes do run a panel of blood tests. Basically, those blood tests will be aimed to exclude other medical conditions that could be contributing to the hair shedding event, such as iron deficiency, vitamin D deficiency, or a thyroid function disorder. Several mechanisms of how COVID-19 causes telogen effluvium have been proposed. The first one would be that of a cytokine storm. Cytokine storm actually refers to your immune system releasing a bunch of chemicals to activate your white blood cells to attack that virus. But these chemicals that are released into your body don't only cause an immune reaction, they sometimes also damage normal tissue and can trigger the onset of hair loss. Or rather, they can change the hair cycle from an anagen phase into a catagen phase and then into a telogen phase, which is witnessed as hair shedding. Another proposed mechanism would be the stress of contracting COVID-19. Especially back in the early days of the pandemic, people were really unsure about what their health status would end up being after contracting COVID-19. Am I going to be admitted to hospital? Was I going to be quarantined, isolated from my family, or even die? And this amount of psychological stress can produce an effect like telogen effluvium. The third proposed mechanism as to why COVID-19 can cause telogen effluvium is the inflammatory response that a person's body would produce when they get the condition. So this infection actually increases the amount of inflammation in your body. If you test the blood, you're going to see large amounts of inflammatory markers. CRP, ESR, white blood cells may all go up. Now, these inflammation also brings about an increase in a stress hormone called cortisol. And this is the stress hormone that increases when you're taking your A-level exams or your final exams of your university. It's the same stress hormone that increases when you have a period of poor sleep. And this increase in the stress hormone can also be one of the potential triggers for telogen effluvium. Now we've come to the important part. How do we actually treat COVID-19 related telogen effluvium? Telogen effluvium can be very scary and can be very distressing for a patient. You're seeing large clumps of hair falling out each time you shower. A lot of patients call up and ask for immediate appointments for immediate treatment. The truth is this: telogen effluvium with no other underlying medical conditions that are contributing to it usually resolves within 4 to 6 months. However, if you're intending to seek treatment for telogen effluvium, Terra has a bunch of ways where we can improve the outcome of your condition, shorten the duration of the shedding, and ensure that at least 90% of hairs that you have shed will grow back just as strong as before. The first mode that we use is to put our patients on a supplement called norepinephrine. This supplement has been clinically proven to keep hairs in the anagen phase without allowing them to go back into a resting or telogen phase. It relies on the use of 3 types of proteoglycans that are derived from fish. There are no drugs in this supplement and it's taken daily, 2 tablets in the morning and 1 tablet in the evening for 3 to 6 months. This helps to stabilize the amount of shedding that you get and also helps the hairs that have already shed to re-enter the growth phase at an earlier stage. We also use weekly regenerative treatments such as Terra Scalp Boosters in a 12-week course to ensure that there's a high concentration of growth factors that are signaling your hair follicles to go back into the growth or anagen phase. We usually continue that for the full 3 months for you to see good results. Quite a few patients tell me that they're actually very stressed about their hair loss. Maybe their job requires their hair to be looking good, or they've really a body image issue about their hair being thin from the very start. So those patients, I start them on Nutrafol stress adaptogen supplements which contain lingzhi mushrooms as well as ashwagandha and nettle, which are known to suppress the effects of cortisol on the hair follicle, reducing the impact of stress on the hairs. Low-level laser light therapy can also be a useful adjunctive treatment. What I mean by adjunctive is if you're already doing all those things that we mentioned above, using this would be a good to have. Now what it does is actually tells the hair follicle to work harder to produce more energy. Energy is required for hair growth, so that stimulation of red light done once a week in clinic can be very helpful to help you get out of the telogen effluvium. Lastly, which is a bit controversial, we may or may not prescribe our patients with oral minoxidil. It is quite an effective and proven treatment for telogen effluvium, but the one drawback is this: when we start patients who have never taken minoxidil before on any form of minoxidil, oral or topical, there usually is a period of initial shedding. So patients who are already recovering or towards the tail end of telogen effluvium, starting them on minoxidil might end up causing them a second bout of shedding, which might make them lose confidence in your treatment. I typically would prescribe oral minoxidil when a patient tells me that they've just started the shedding process post-COVID-19. This is because there's going to be some hairs that are shedding anyway. Minoxidil might also time in correctly with that shedding phase. The overall end effect of 4 months of continuous usage is good, strong hair growth. So, What can you do if you suspect that you are having telogen effluvium after COVID-19 infection? Firstly, get in contact with your local hair restoration practitioner. Secondly, get enough rest. Control your stress. Manage it well by meditation, exercise, and doing things that you generally enjoy rather than focusing on the amount of hairs that are dropping out. Thirdly, make sure you get enough nutrients. Eat a healthy, varied, plant-forward, balanced, whole food directed meal. These are going to give you enough nutrients so that when the hairs are ready to go back into growth phase, they're going to be growing strong and cause strands of hair. However, if the shedding is really severe and affecting your self-confidence or self-image, you can also consider using some temporary coverage for areas of scalp that are exposed. Examples of that would be to use a reputably branded hair fiber or hair powder to cover it up, or to cut your hair or style your hair in a way where it covers up the areas of thinning. So in summary, COVID-19 related telogen effluvium or hair shedding is more and more being recognized as the real hair loss condition, a medical hair loss condition. Try not to stress too much about it. We've already given you some information about how to deal with it in its initial stages. Seek help from a registered medical practitioner, especially someone who is well versed in treating hair loss conditions. Definitely do not go to a salon that promises you a quick fix, especially those that charge you a bomb because you may not be getting what you're paying for. But most of all, do understand that telogen effluvium as a medical condition does usually resolve itself within 4 to 6 months, and you start seeing good hair growth 9 to 12 months later. So if you've contracted COVID-19 and you've had hair shedding or telogen effluvium following that, let us know your experiences in the comment section below. And if you like the content, please click on like and subscribe for more information on hair loss topics. Thank you and see you again next time.